Here you go, Mummy, here's a cup of tea for you.
For 85-year-old Kula, this winter has been a road to recovery. 5 months ago, she fell at her home in Cornwall and broke her hip. She lay on the cold floor for 14 hours before an ambulance arrived.
They said, well, we're just waiting for an ambulance to free up to come to you, and we don't know how long it's going to be. We are so busy.
But getting an ambulance was only the start. Getting into A&E took even longer.
How long in total did your mum have to wait in that ambulance?
26 hours. Basically, the ambulances are now waiting rooms because there's no room in the hospital to take them. There's no extra wing, there's no bed space. I was in disbelief and I was like, this can't be happening.
How do you feel that you had to wait 40 hours to get into hospital?
Well, it's scary. It's more scary than anything. I would have been better die so many hours.
The Royal Cornwall Hospital offered its sincere apologies to the family, but their story is not unique. Latest NHS data, analysed by Sky News, shows that on average in the South West, ambulances had to wait 2 hours and 39 minutes to hand over patients to A&E. That's almost 3.5 times longer than the national average. The target is 15 minutes. The problem is so bad here that the 6 NHS trusts with the longest handover times in the whole of England are all in the South West. An older population spread remotely is part of why things are so bad here. The hospitals in the South West are under such extreme pressure that in some cases they've started to discharge patients who are well enough into hotels, usually used by tourists, in order to free up some bed space. Those being put in care hotels are well enough to go home if there's some social care available.
One of the blockages coming out of hospital is community care provision, social care. So if there's no provision in the community, you can't get people home. If you can't get people home, they stay in hospital. If they stay in hospital, there's a whole host of challenges associated to that. Hospital-acquired dependency.
The NHS told Sky News delays in the South West are down to the number of sick patients, staffing issues and delays discharging from hospital. It added, we are working hard with integrated care boards, hospital trusts and our ambulance service to address these delays and ensure patients are handed over at hospitals in a timely way. Kula's 40-hour wait is an extreme case, but it's an example of how the NHS in the South West is struggling to cope. Dan Whitehead, Sky News in Cornwall.